Most of you are too young to remember how devastating the AIDS epidemic was in the 1980s. With no effective drugs, thousands of people were dying in the US. Americans were afraid. People with AIDS in the US then were mostly gay men, and they were severely stigmatized. The gay community fought hard to get AIDS treatment through the regulatory systems. In the late 1980s, they developed the first drug to treat AIDS. In 1994, it was found that the same drug could reduce transmission of HIV from a pregnant woman to her infant. Administered intravenously every day to women in their third trimester, it was expensive and only available in the US and Europe. After my master's degree, I took a research position in Thailand on an NIH clinical trial conducted with Thai pediatricians and the Ministry of Public Health. We tested a drug regimen that was simpler and cheaper that could be used in developing countries where there was less health infrastructure. Without preventive treatment, about 35% of pregnant women with HIV passed HIV to their infant. With research that I worked on along with others, we found new drug regimens that could reduce that to nearly zero in research settings, but not yet out in the real world. But I wanted to take this work out to where it was really needed. I took a technical job with USAID in Kenya, and when I got there, I noticed that the logo attached to everything we did said, "From the American people." I thought, wow, that's us. People at USAID took their responsibility seriously and were proud of it. But not every day was exciting. Each program went through extensive review before, during, and after any money was spent. My job was to advise USAID in 12 countries on the program to prevent HIV in newborns, at a time when only 2 of these programs existed in Africa. I worked with USAID colleagues, officers in the ministries of health, and staff in clinics and hospitals. When the World Health Organization released new guidelines recommending the simplified drug regimens, it captured the attention of governments all over Africa who wanted them for their countries. So I was really busy now, but there was still limited funding. USAID did begin funding programs for pregnant women with HIV, but already thousands of infants in Africa had been born with HIV, and 80% were dying before they were 3 years old, because there were no drugs and the doctors didn't know what to do for them to help them. Entire families were being wiped out. One visionary Ugandan pediatrician, Dennis Tindiebwa, dedicated his career to helping these children when no one else was. Not UNICEF, not the WHO, not governments. Dennis came to USAID with his idea, and USAID finally agreed to support his network of pediatricians dedicated to HIV care. This group developed practice guidelines for diagnosing and caring for children with AIDS in Africa. Their handbook would soon be found in doctors' pockets and clinics across the continent, and countries brought them in to train local doctors. No one had the drugs yet to stop HIV. Outside of the US and Europe, HIV drugs were scarce and really expensive. Dr. Tony Fauci and others successfully encouraged George W. Bush to create PEPFAR, the President's Emergency Plan for AIDS Relief. PEPFAR funded USAID and CDC and some other agencies to address the AIDS epidemic in Africa. This bold program was the face of America across Africa. Millions of adults in treatment and children went on life-saving treatment, including these now adolescents who were born with HIV. Millions of infections were prevented. This successful program enjoyed bipartisan support and saved over 25 million lives. I left USAID after 6 years to work for an NGO scaling up these services for pregnant women in Africa. I was now on the receiving end of USAID program funds, working with ministries of health to develop and oversee new services of HIV testing and treatment at antenatal clinics. PEPFAR funding enabled African physicians and nurses that I hired and trained to implement programs to ensure that the government programs we supported were of good quality. At every step of the way, this required changes in the way people worked, both in the Ministry of Health and in the clinics. Doing the same old thing is easy, but I tell you, these changes were especially hard. But with the science, the right vision, the funding, and incredible and innovative teams, we found new ways to work and made giant advances in scaling up prevention of HIV to reach 95% of pregnant women in Africa. I've talked about a few of the heroes in this work, but there were so many others, including the women who participated in the programs and the research. They helped me feel the hope that these programs brought to them. With PEPFAR, communities, families, and countries began recovering from AIDS. But now it was time for me to come home. I left the intensity of this work to retire to my quieter life in Asheville with my husband, volunteering at Greenworks, visiting family, playing piano, and sitting on the deck reading. It was really great until about 6 months ago, when I began to be assaulted by reports of the so-called criminals at USAID. I've had to watch USAID's former champion, Marco Rubio, turn USAID into a tiny, useless department helping only countries who can enrich the US. There is now no room in our government for development, which was the third D in our national foreign policy. US foreign aid used less than 1% of the national budget, but turned around a pandemic. It provided contraceptives, food aid, and economic growth. The destruction of USAID hurt millions worldwide. I'm heartbroken, but I don't know whether I should scream in rage or should I cry. Taking liberties with a famous poem, first they came for USAID. They may not have come for all of us yet, but I feel like they've come for what's important to me, for the things that make us all human, for the things that have made this country great. And let us learn from the past and not forget. We must speak out. Thank you.